Welcome back to my channel. My name is Dr. Sahara Omar. I am a licensed marriage and family therapist practicing here in the state of Texas. And today's video, I wanted to share with you guys what is ADHD, where does it come from, and how do we overcome it. Before we dive into the video a little bit more deeper, I did want to make a huge disclaimer. In the mental health space currently, we do not have cure for a lot of these diagnoses that I'll be sharing with you guys. We do lean into a little bit more of a recovery model where we know these exist and we are just doing the best that we can to help individuals heal and overcome some of these diagnoses that we are witnessing in human experiences, okay? So with that being said, I also highly recommend to not over-identify with these diagnoses, right? So I usually like to give this example to my clients. If we have like a body injury, like let's say you broke a leg, or also like let's say you just have an infection, right? We do not walk around telling people that this is who we are, right? Like we don't tell people, hi, my name is blah, blah, and I have a broken leg, right? Or hi, my name is blah, blah, and I have an infection, right? So we usually do a better job to go to the doctor, get the right treatment. It does take time, and then we overcome either the broken leg or the infection. It's the same thing with any of these diagnoses, whether you have anxiety, depression, ADHD. The goal is to overcome them and not just hold on to it as part of your identity, okay? All right, so what is ADHD? ADHD is neurodevelopmental disorder, which means the brain is not functioning the way it's supposed to be functioning. The neurons are not talking to itself. Typically, it is also known as an executive functional disorder, where the body and the person is not able to slow down and think through the decisions that they have to make, okay? Now, before I tell you guys a common sign, where does it come from, right? Sometimes we do see it running in families where like dad, for example, was ADHD, then the son is ADHD now, right? Or the granddaughter is ADHD as well. So part of it is genetics. The other piece is also being raised in chaos and dysfunction. Majority of my clients who either think that they have ADHD or been diagnosed previously with ADHD, the common theme that they have is they grew up in chaos. Similar to the picture here, where there was no order, there's a lot of yelling, a lot of moving pieces, no sense of time, no sense of routine or structure. Sometimes some of these clients will tell me that they raised themselves, they didn't have any adult in the home, no one truly modeled for them how do you slow things down and be a little bit more on time and completing things on time as well. In other cases, I've met clients who had some sort of an order, but they also experienced physical abuse. So sometimes trauma can mask itself as an ADHD, and our job in therapy is to sort things out, right? Like kind of identify if this is just being raised in chaos, or is it because you experience a physical or sexual trauma that is making you dysregulated at the core, okay? So common signs. These are the common signs that we see. Typically with the DSM-5, you do have to have at least 6 of these, 6 diagnoses, 6 traits before you can be diagnosed. And it has to be also seen before age 12 for you to be diagnosed with ADHD as well. So the common one is easily distracted, struggling to, like, for example, focus or staying on task. I see a lot in therapy, for example. Some of my clients will jump from one conversation to another. I did this and I did that, and then this person said this, and we have to kind of, usually that's a giveaway for me to ask them also to slow down, that maybe they do have ADHD as well, okay? They have a lot more, the second common theme is forgetfulness, like forgetting like appointments and tasks and where things are, almost in living in a fantasy space mentally where they're not connected to reality. Sometimes running late to an appointment, and that's another giveaway in the therapy space, is client running late and forgetting about an appointment and not having true like routine, something that they will go back to and kind of challenge them. Hey, you have an appointment today, you need to go. Like no calendar, nothing like that. Very impulsive, either emotionally as well too, or with tasks, right? So they interrupt other people. They tend to make a lot of quick decisions without thinking. Emotionally very dysregulated as well too, like feeling emotions intensely, either intense anger, intense sadness, just living in like almost like a YOLO mindset of just doing things and interrupting people and not slowing down and being a little bit more adult-like. There's another common sign is frigidity or restlessness, like not being able to sit still in a chair. Typically ADHD individuals or individuals who think they have ADHD in the therapy space, they're not able to sit on the couch in my office like steady still. They move a lot. Sometimes I have a fidget toys that I will give them just to kind of wrestle with a little bit as they are talking through things, but they just can't sit still. They have to move their body. Their body feels unease to hold itself in one place. And then the last common sign is going to be disorganized, similar to the forgetfulness, but in a way they do not have any kind of like time management, like something called time blindness, where they lose grasp of time or forget like how long it will take for a task to be completed. Like going to the mall, for example, and then spending there for 5 hours, right? Like forgetting like, whoa, I have other things to do. I need to go home. Completing tasks on time is not organized as well too, and not keeping things in order. So the house, for example, clothes is everywhere, food is left out, dishes are piling up, not paying bills on time, right? Like it's just a little bit more like similar to like I've shown you guys here in this picture, just constant chaos where the body does not know how to like, hey, let's organize things, let's show up in a consecutive, orderly fashion as well. Okay, so some tools, right? Like how do we overcome this? So it does take time. Like I said earlier, there is no true cure, quote unquote. First, we have to recognize, okay, these are the signs that I have. Link it back. The brain always wants to know where things come from. Truly spend time. This is what I highly, again, recommend go into therapy, because your therapist will challenge you to recognize if you come from chaos, right? Like, was mom and dad orderly fashion people? Did they complete things on time? Did they teach you how to wait for your turn and think through things and not just be impulsive and running rampant all the time as well, right? The common tools that I teach my clients is sometimes I would challenge them to create a schedule in session. Like, what time are you going to go to bed? What time are you going to wake up? What times are you going to eat? And I would ask them to something called stacking habits, where they have to do one thing at a time, right? Like, so this week, just focus on going to bed at a certain time, wake up a certain time. Next week, we'll focus on what times are you going to eat? And the following week, we'll focus on what times are you going to work out. Also identifying a calendar system that you want to work with. Do you like, for example, Apple products, or do you like Google products, right? Like, so that way you can follow through things and hold yourself accountable. Also learning how to take breaks from things as well too. There's a technique called Pomodoro time management technique, which helps a lot more. Like, if you're going to complete a task, you do it for 25 minutes and then you take 5 to 10 minute break, and then you challenge yourself to go back and finish another 25 minutes. In a way, you are teaching your brain to have executive functioning, where you're not just reacting like a child, right? Where you are showing up as an adult, and learning how to separate your younger self who didn't get that level of support from your adult self who has to learn how to create these habits from scratch again, okay? And over time, you'll get to a place where you identify that you are in control. I do have another video I will make in the future. The hardest part for all of my clients is the separation between the younger self and the adult self. Sometimes if there is no adult self, we have to create adult self from scratch, right? You build the adult self because that's maturity, that's getting older, right? Versus just letting the younger self drive the car. And I have an illustration that I will show you guys in the future as well. All right. I hope you guys liked the video. Feel free to hit that thumbs up, leave me a comment, and I will see you guys in the next video. Thank you.